Hi, my name is Juan Dorte, and in this video, I'm going to go ahead and talk about step by step and then demonstrate how to perform a finger stick procedure on the patient. This is a very uncomfortable procedure. I know it is for me, but it still has to get done. We use this procedure to collect small amounts of blood to check for glucose, the hemoglobin, and sometimes check for microhematocrit. The supplies needed for this procedure are a sharps container, Hemi-Q with the culette, two capillary tubes, a lancet sorry, a glucose meter with the strip, gauze, alcohol wipes, and gloves, which I have on already. After we have sanitized our hands, we verified our patients and verified our physician's orders. We're gonna go ahead and put our gloves on, which I already have on. And then the goal with this capillary puncture is to puncture a patient only one time, but to be able to collect enough blood for all three tests. Again, they are the hemoglobin, two capillary tubes with no air bubbles in them, and the glucose test. Our two optimal fingers to puncture, what to use for this procedure, are the ring finger and middle finger. These two fingers right here. But not the middle part of the finger. You want to go ahead and puncture the outside aspects of the finger. And for this procedure, it's safe to have enough gauze to use for this procedure because this test can get a little bloody. So it's safe to have enough gauze, which I have. I have like about 3 gauzes here, just to be safe. So we begin by cleaning the patient's finger with an alcohol wipe on the ring finger. You grab the lancet, which I have here, and you apply downward pressure on the finger to engage the lancet. You use the lateral aspect of the finger, press down the lancet on the finger, and then you throw the lancet away in the sharps container once you're done using. Afterwards, you go ahead and wipe off the first drop of blood. It's very important. And then you're ready to collect blood using the capillary tubes, which I have here. Two capillary tubes. You want to hold the tubes not directly to the skin, but on the drop of blood, but holding it at an angle so that it will prevent any air bubbles from entering the tube. Once blood has been reached to the red line, you want to go ahead and cover it with your finger and insert it into the clay, which I have here. I'm going to go ahead and twist it, and the clay will seal the tube, and you put it on the holder. And then you're going to go ahead and wipe off that bit of blood, that's extra on the finger, and use your second tube to collect the drop of blood. And once the blood has been reached to the red line, we're going to go ahead and put our finger over it, noticing there are no air bubbles on the tubes, in the tube, sorry. And then you're going to go ahead and twist it, the clay will seal it, and again, you put the second tube in the holder. After that, we wipe the blood off again on the finger, and then you open up your cuvette. I'm going to be using this. Afterwards, you're going to go ahead and collect the drop of blood, and you're going to place it in the machine, the Hemi-Q, and then you close it. Once that is done, we are ready to collect our glucose test, which will be our final test. We will go ahead and insert the strip. So, using this, that's the machine. Once you insert the strip, the machine will turn on. You wipe the finger off, apply a little pressure so that you collect the blood, more blood can come out, and you will go ahead and place the strip right over the blood. And once the blood has been collected, we'll go ahead and place the machine down. Have the patient put pressure using the gauze that you will give them. And afterwards, we have collected our 3 tests. And for example, towards the end, our results will be that the hemoglobin is at 12.4. The glucose of the patient is at an 88, and our 2 capillary tubes have no air bubbles. After that, that is how you perform a finger stick on a patient. So I'm going to go ahead and do it on the patient. But in this case, we're going to go ahead and be performing it on the bunny. So I'm going to go ahead, place this here, ahead and get the patient's press on here. I'm gonna go ahead and pick the finger, which will be the ring finger. I will go ahead and get alcohol wipe, clean the finger. I will get my lancet and apply pressure. Once the finger has been already air dried, I will go ahead and start the procedure by using the lancet, applying pressure on top of the finger, in the corner, top aspects. You apply downward pressure, boom. Once you're done using, you place the lancet in a sharps container. Okay, wipe the first bit of blood that you see. Then you will go ahead and get your tube, hold it at an angle so that you will not prevent any air bubbles from entering into the tube. And once it has reached the red line, you will go ahead and cover the top and then put it in the clay. Have here. You wouldn't obviously do it in front of the patient, but in this case I'm showing you how to do it. And twist it. And then you place it in the holder. But in this case it's not gonna stick, so I'm gonna go ahead and just leave it here. But if it was an actual clay, it'll stick. It'll just stay up like this. So I'm gonna go ahead, wipe the blood, apply pressure, get my second tube, repeat the process again. No air bubbles. The blood has reached the red line. Good. Hold it, twist it, the clay will seal it, and then put it on the holder. Once that test has been collected, I will go ahead and wipe off the blood again. Open the cuvette, apply pressure, and just collect the first drop of blood, and then place this in the Hemocue. And once that test has been done, I will lastly go ahead and wipe out the blood in the patient's finger. Get my glucose meter with the strip, put it in, the machine will turn on. Once it is on, I will go ahead and apply a little pressure on the finger of the patient so I can squeeze some blood out. And then once I see the first drop of blood, go ahead and insert the strip on top of the blood. Once the blood has been collected, I will set it down, grab a clean gauze, ask the patient to go ahead and apply pressure on the finger, and we go ahead and write down the results, and that's basically it. And afterwards you go ahead and get the results to the lab, and yeah, that's it. So if afterwards you can go ahead and give the patient a band-aid to stop the bleeding. And yeah, so this concludes the video. Thank you.